Hello, hello. Welcome back for another episode. And so excited to have Britt here with us. And we're really talking about how to advance medical researches and better treatment plan. And before we get going, hopefully you guys have a wonderful day. And then we will get started with today's conversation. And let's play our little quick intro so you can get a sense of who we are.
Welcome to Health Tech Growth, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.
Hi, everyone. Britt is the founder and CEO of Geno.me, a biotech company enabling people to monetize their health data while advancing medical research to find better treatment and potential cure for rare disorders and conditions. And now we know sometimes with big data, we always think about what do we do with that? Who's protecting it? And how can we really help ourselves and others to advance medicine altogether? Now, Geno.me has raised nearly $3 million in funding and is focused on expanding its health data, contributing base from current 1,000 to 100,000 plus in 2024. And they are already working with a pharmaceutical clinical trial research institution in Wisconsin, Ontario, and have partnered with genomics as well as contract research and patient recruitment organization across the US. So she is definitely a true jack of all trades and have worked in several industries for the past 15 years and managing and developing multiple teams in healthcare services, business communication, project management, and insurance sector. So it's interesting that you put all these expertise into one umbrella. So Britt, tell us a little bit more on at what point did you feel like this is the niche that you want to truly go into, and then you found such a passion and building a company behind it?
Yeah, I mean, I feel like I have been in a lot of different industries, and when you get to dip your feet in a lot of different uh, with a lot of different teams, working with a lot of different companies, you pretty quickly will find out that there's a lot of different problems you could solve, right? And so it was finding which problems that I wanted to really like sink my teeth into, figuring out like how we could make X, Y, and Z more sustainable, what problems had the biggest pain points, and essentially what could we do to solve them. And so there were no shortage of problems in the industries that I have worked in, finance, insurance, and healthcare. But when COVID hit, it was one of those things that, there's a lot of job security in healthcare, and there's tons of problems that could be solved there, especially ones that appeared or were exacerbated after the pandemic.
Yeah, and definitely it's always feel like needle in the haystack sometimes to say like what is the pinpoint of demonstrating this is the problem that's worth solving versus all the other ones that we see that should be focusing on, right? And how did
Mhm.
you come up with the decision to say this is a sector that you believe is worthwhile? We always believe how can we creating traction and continue to uh, help other people to create jobs, right? And at the same time, making healthcare better.
Yeah, I mean, one of the things that equates to better clinical research outcomes, I think, is looking at the source of the data, right? Figuring out like where exactly you're going to get it. And a lot of times these organizations will get data that's been kind of telephoned, right? It'll be passed around from company to company or to pass around from department to department. And a lot of times, you lose the value of where that data comes from and essentially who is providing the consent and who is owning that data. And so I guess the concept for Genome was really trying to be truly patient-centric with data that is very sensitive, that we know is getting shared constantly, that also can contribute to different types of research outcomes, but also looping in the public, looping in, people like you and I into a process that, traditionally that haven't been looped in before. I mean, for example, how many times have you gone to your doctor and they might have brought up clinical trials with you? For me, that's been zero, right? And I don't think it should be something that you just learn about when you're sick. It should be something that you are constantly aware of, and how you can be more involved in that space as somebody who can contribute data or can be part of different populations that are being studied. And so I think that when we look at advancing clinical research, I think it really has to start with the source of the data and the consent that is given around the data that is being used.
Exactly, because clinical research, no matter what, we want to have the control as well as people who has the disease. And sometimes even when I used to be involved in lung cancer screening or even treatment side, then it's still a randomized control, right? Like who's gonna get the chemo radiation versus us doing surgery on them, and everything it needed to be really thought about, talked about, because then give people even more option, and not just to say, hey, there's our three different options and go pick one, right? And then despite how much from a clinician perspective and teaching them, and it still feel like it's a blur versus something that's more of a clinical trial, seems like giving people the additional possibility without having them to feel like, oh, I have to make the final decision. I am contributing, right? And in some sense, it's helping themselves and helping society. So it's a feel-good project at the end of the day, would you say?
Yeah, definitely. It is. It's a feel-good project, but it's also something that I think has the potential to help. Whether that's with the advanced individualized or personalized medicine, pharmacogenomics, or anything that requires some kind of genetic tie, and then being able to look at the data around how genetics and environmental impacts can have a link on the way that people respond to different types of treatments, drugs, et cetera. So I think it's very useful, it's very valuable. Another area that I think it can be valuable for is the research of gene therapies. Ever since CRISPR emerged in the early 2000s, it was something that could really revolutionize the way that we take care of ourselves and are able to treat different types of cancers, rare conditions, and rare diseases. And so I think it's something that's very valuable, and the research in those fields is only going to continue. It's going to increase, and I think that's going to be the future of how we continue to be cared for when we go to the doctor. We're going to have highly specialized, individualized care plans based on our environmental factors and our genetics.
Yes, and in that sense, how have you guys been engaging and go to market about the solutions to be able to connect with, as you're saying, the right players, so they know how to be involved, whether it's from the patient side or organizations or other individuals, to make sure that this is getting to the right hands and the company overall is growing?
Well, thank goodness in the industry that we're working in, a lot of the early stage partners and clients that we've secured have been through word of mouth. It's been through people that are interested in not only doing the research but innovating and looking at different ways to get different types of data, and really trying to figure out how we encompass everybody to be a part of this. So it's been a lot of through word of mouth with some of the research organizations that helped us design the platform here in Wisconsin. They were some of our first clients, and they're some of our first partners. And so to be able to work with them, gain some traction, and show that this is something that could be very valuable, and this is a methodical approach to bring different types of populations, getting them involved in clinical research. That's been something that's really helped us initially. And as we continue to grow and scale, we're hoping that as we add more and more contributors to the platform, as of today, we're a little over 2,200, which is really fantastic. But as we continue to add more contributors to the platform, get people more involved and educated around the benefits that being involved can have, that by proxy is going to continue to attract different research organizations.
Yeah, so for now has been all organic growth and word of mouth and really building that community relationship that you guys already have existing locally as you scale up from there. I think that's a good point for many people to even hear about. Most people believes that word of mouth works the best, and then we know by research usually they can convert 3 times higher than any other marketing strategy. However, it needs to be very strategic, right? We can't just like go around talk to everybody, and that takes a lot of time, and then it could be the wrong people to talk to, and they can be
Right?
like, hey, congrats, this is amazing, but they don't take action, right? So how have you guys been overcoming that challenge about reaching out the right people and then being able to do the proper follow-up?
Yeah, I mean, with the ability to be able to democratize and monetize health data, that appeals to a lot of people. But there are certain populations that it can be more beneficial for when it comes to, doing clinical research. So the populations that we've seen and that we've been trying to recruit primarily to the platform have been either like cancer patients, anybody that suffers with a rare or debilitating disease, because we know that a lot of those cancers, a lot of those rare diseases have a genetic component to them. And in addition to being able to link health records on our platform, we're also able to provide a source of genetic testing. And once we're able to get all of that data in one place on somebody that might have those conditions, that becomes something that is a very is a very rich data set that's able to be studied by a researcher population. So we do have a lot of members in the platform that are coming to just be more altruistic, that are like, here, I want to contribute my data. I want to help with any types of research that are being done, but primarily we're focused on those populations that have diseases or conditions that have some kind of genetic predisposition or tie-in.
Right. So you're attracting people both from that, hey, you're contributing to this great thing, and you can monetize it from this thing because it's healthcare at the end of the day is very expensive. So
Mhm.
be able to almost offset all the treatment costs that you have, despite how good our insurance plans are, right? And a lot of these newer treatments, they're not necessarily all covered anyway because they're still in trial period. So it's helping people to see the benefit and value at the end of the day to be able to convert. What would you say is one of the thing, if I give you a magic wand and give you like the genie in a bottle, give you 3 big wishes, what would you use the 3 wishes for?
Well, first and foremost, to get everybody genetically tested. Everybody should have their genetics tested. They should have genetic testing done, because there's a lot of benefits to that. I think that not only does it provide a full scale picture of your health in addition to your health record, which determines environmental factors, but those genetic tests, those are things that you can't control. Those are things that you inherit. And I know a lot of people do get a little bit hesitant around finding out if they do have, a disease that is genetic, or how they might develop certain health conditions in the future. But preventative care, and then also being proactive, that's most of the battle. So being able to understand more about yourself will end up helping you become healthier long term, and it'll also help with research, because there's a lot of preventative maintenance, so to speak, that can be done around making sure that you're taking care of yourself if you know that you might be predisposed to certain conditions. I think the second wish that I would have is, to be able to tell everybody about GenoMe, but on a platform where, they're really interested in what we're doing here. Want to continue to engage the populations that believe in the mission of what we're doing, to really get different types of people involved in, advancing clinical research. And then on the third part about, I guess the third wish that I would have would be that I don't know. It would be really cool to meet like Stephen Colbert someday or something. I've always liked him, and I've always liked his show, and I think he's hilarious. So if he watches this podcast, there you go. Hey, Stephen.
Yeah, shout it right out there, right? We have the manifest to get out and then really go for it. Well, let's just say, as the company grow, we always get to the point of, wow, okay, this is exciting. We're getting in the round, but then getting a full board advisor who has all the expertise to help you, sometimes that can be a challenge. Let's just say we have a full board at your disposal, right? Any question you can ask. what would you be one of the questions that you would die to ask and get answer to?
I guess like the one question that I would ask is, I know market, like essentially what we do on their platform, it's a marketplace model, right? And so there have been other marketplace models that have scaled. PayPal, I think, is a famous one that most people know, but really adapting that into health tech, because it's very different when you're trying to, get people to link different types of data and sensitive data at that, but also making sure that there's a trust component around that, and then turning that around and being able to scale it in the way where you have enough members that are part of the platform, or contributors as we call them, to be able to appeal to those research organizations, or pharmaceutical companies or CROs, and then continue to get their interest, and then on top of that being able to get more people to want to contribute their data and be part of research. So I think like just getting insights on making the marketplace model run smooth from a health tech standpoint. I mean, I always am open to taking any advice that I can get. But that's something that has been a really unique challenge that we've been trying to figure out. And I think like we've been solving it pretty well. And as we continue to grow and scale, there are different challenges that we'll face at each level. And so just to be able to have that interaction, or at least have that feedback from a board would be really awesome.
Yeah, that's amazing. So if I just ask a little bit of clarification, when you say run smoothly, in terms of what do you mean? Like influx of people that's continuous and making sure that you retain the members, what the smoothness means for you?
Yeah. The smoothness is continuing to keep all types of people that are part of our platform engaged, not, just engaging people that are new members to the platform, and then, other people starting to drop off. But then also, keeping those other people engaged, regardless of what the research is being done or what's popular in terms of being research, right? We might have members that are on the platform that signed up because they want to be part of studies that are favoring chronic diseases like type 2 diabetes. But maybe if the research population that we have looking for that data isn't interested in searching for that population with that chronic condition, how do we continue to keep them engaged, right? As they might search for other types of conditions that might be more prevalent in the research space at that time. So it's continuing to keep all of these members with different types of conditions engaged, and then also keeping our researcher populations engaged, because they're going to be looking for different types of things to study, different types of issues, conditions, illnesses. And so, if we don't have a critical mass of a certain population, making sure that we can get that critical mass in so that they're able to study those people. So there's a lot of moving parts there, right? But to always get feedback on that and continue to refine that is something that I think would be really valuable to learn from a board.
Perfect. And then as you guys know, we do the live session, and then we're going to go ask our board about answering this question. Now, of course, we only get a brief understanding of Britt, but we're going to try our best. And this is definitely an exciting conversation. Big data has been presented in conferences, and how do we leverage it? How do we really become empowered by our data and share with the world and gain information back on our health from both preventative side as well as the treatment side. So we're excited to see what really come of you guys as you guys are growing for Geno.me, and excited to be seeing and be part of your journey in this small way. So until next time, we so appreciate everyone from watching this, and keep it up. And if you wanted to get those answers, come to our podcast.
Welcome to Health Tech Growth, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.